Hello, and thank you for having me here today. My name is Susan Matick. I'm an FY2 at Worcester Acute Royal Hospital. I'm here today to talk about a project that I've been involved in which aims to highlight the importance of ambulatory surgery in the new COVID-19 era. This is relevant to us now during the current COVID-19 era that we find ourselves in. There is more pressure on elective surgical services than ever before, and this is in addition to those patients who were already on waiting lists. Within our trust, all elective surgery was suspended during the first acute phase of COVID-19. Services have slowly been re-established with much planning and consideration of the safety of patients and staff alike. The strategy to restart elective surgery has had to encompass overcoming multiple challenges, including, but not limited to, staffing issues, hospital capacity, post-op care availability, and patient concerns. The introduction of colour-coded patient pathways and the utilisation of theatre space at local private hospitals are two such solutions that our trust have implemented. Thinking about the aim of our project, the recent report from the Get It Right First Time programme has identified that day surgery is an under-implemented resource that is pivotal to the recovery of surgical services. The advantages of day case surgery are well known and well documented, in particular, significant increase in productivity, as well as improved patient outcomes. Therefore, the aim of our project is to review the number of day case operations that were occurring pre-COVID within our trust and assess the recovery of this service as those services were re-established. Are we utilising this pathway to its maximum potential? We will quantify the recovery of day case surgery and acknowledge any variation we find between surgical specialties. This was a retrospective study. Data was first collected from the 1st to the 30th of November 2019, whilst elective surgical services were running as usual in a pre-COVID time. And then again from the 1st to the 31st of August in 2020, once elective services in the Trust had re-established after the first peak of COVID-19. Data collected included all day case operations carried out within the timeframe by all specialities. Day case procedures were included as per their inclusion in the British Association of Day Surgery Directory of Procedures. In phase 1, there were 2,011 day case procedures carried out, and in phase 2, a total of 733 procedures. In phase 1, 3 local general hospitals contributed to the NHS elective surgical service, whereas during phase 2, this is expanding to 5 local hospitals with the additional use of 2 private hospital theatres. I have highlighted here the 9 surgical specialties included in the data collection and their respective numbers of different types of procedures. As is evident, not all surgical specialties lend themselves equally to elective day case surgery. We see here ENT, general surgery and T&O having over 20 different types of day case procedures, with vascular, breast surgery and MaxFax having under 10 different types of elective day case surgery. And so looking to our results, this bar graph shows the comparison between total number of procedures separated by specialty during phase 1, which is green, and phase 2, which is red. It is clear to see that ophthalmology and trauma and orthopaedic consistently perform the most day case procedures. However, every specialty shows a reduction in total number of day case procedures performed in phase 2 compared to phase 1. Is this a significant reduction? We're using the paired t-test. We ascertained that across the board, the difference between total day case procedure numbers between phase 1 and phase 2 is significant, to a p-value of 0.007. To further interrogate the reduction and recovery in service provision, we look at the percentage reduction and the percentage recovery of each specialty. The recovery of day case service provision on average across the board is 36%. There is Variation between specialties. The highest percentage recovery is in breast surgery at 47%, whereas as you can see, ENT, urology, general surgery, and obs and gynae all have a recovery of over 40%, whilst vascular surgery in our trust shows the least recovery of day case service provision at 8%. It is also pertinent to comment that therefore, on average, our trust-wide elective day case surgical provision has reduced capacity by over 60% due to the interruption of services caused by COVID-19 in the first acute phase. To conclude, this project has highlighted that there is an ongoing significant reduction in day case surgical provision within our trust. However, despite the really challenging circumstances, 5 surgical specialties have recovered services to over 40%. There is a large variation between surgical specialties, potentially reflecting the change in demand for services and the acute pathologies as managed by the different specialties. We have shown that our day case service provision has recovered by just over a third as we enter this innovative journey to re-establish our elective surgical day case provision. We must continue to embrace the advantages of ambulatory service within our trust. The benefits extend both to patients, their preferences, their outcomes are improved, and their safety is paramount, as well as increasing our productivity and therefore our capacity. And at a time with ever-expanding waiting lists, this is increasingly more important. In particular, within our trust, we must consider if there is scope to further transition even more elective surgery into an ambulatory service, because now is the time to invest in these new proficient day case pathways that are going to help facilitate the restart and catch-up required to overcome the interruption caused by COVID-19. Thank you for your time today.